Hi, in this lecture, we are going to start our study of blood vessels and chapter 18. Now, a quick review, you've already learned the blood. The blood is the transport medium. The blood transports the substances throughout the body. The blood vessels are the pipes. These are the tubes that are going to carry the blood and allow the blood to exchange all sorts of things with tissue cells. But you need a pump or a force to push the blood through, and that is the heart. The heart is the pump. When it contracts, it generates the pressure, known as blood pressure, which propels the blood through the pipes. So when we start our study of blood vessels, you've already learned the three basic types of blood vessels. We have arteries, capillaries, and veins. Now we know that arteries are going to transport blood away from the heart. We know that veins will transport blood to the heart. And we know that the capillaries are the smallest vessels and also the most numerous. It's been estimated that there's over 60,000 miles of capillaries in the human body. And the capillaries exchange the hormones and ions and gases with all the tissue cells. When we look at the structure of a blood vessel, the inside is called the lumen, and there's three layers we'll see. There's the tunica intima, which is known as an endothelium. Notice it's made up of simple squamous epithelial cells, so very, very thin. The middle layer is the tunica media, think M for middle. And this layer typically has smooth muscle and some elastic fibers. Remember, elastic fibers is going to allow recoil, and we're also looking at smooth muscle now. The tunica externa, or adventitia, typically externa is used, is the outer layer of the vessel. And this is the outer layer that surrounds and supports the vessel. It also can anchor it to other vessels in the area and other structures. So we're going to start looking at these blood vessels in more detail. When we look at arteries, there's two types of arteries. Now, arteries are going to always have the highest pressure. So they're subject to the greatest blood pressure. And so there's two types of arteries. There's elastic arteries, which are going to have some elastic fibers. So they're going to be really good at that recoil. So when the ventricle contracts and it hits that blood, right, it squeezes that stroke volume out, that elastic artery is actually going to stretch, and then it's going to recoil. So these are the large arteries next to the heart. The examples would be the three that come right off the aorta. Remember, you had the brachiocephalic trunk, the left common carotid, the left subclavian, and even the right and left subclavian. So these are right near the heart. They have all three tunics. They are going to have a lot more elastic fibers in the tunica media, which makes sense, right? Because they're responsible for the recoil. They are going to have, of all the arteries, the largest lumens. They'll have the fastest flowing blood. And they have this extra membrane called an internal or external elastic lamina. Now, we're not going to worry about exactly where those are, but just know they have extra elastic tissue to really help with that recoil. In fact, that recoil is critical because that's responsible for what's called your pulse, your arterial pulse. So when blood hits the vessel, it's going to immediately stretch. But then it's going to snap back like a rubber band. And when it snaps back, it actually causes a wave. It causes a pulse wave through the vessel. And so when it snaps it's kind of like if two people hold a rope and you snap the rope, that wave goes all the way through. So your pulse technically is representing the amount of times that blood is hitting your aorta. Because every time it hits the aorta, it stretches and it recoils and it propels that further on through the pipes. The muscular arteries are most of the arteries we learn. We're looking at brachial artery, femoral artery, radial artery. So these are most arteries of the body. Their tunica media, their muscular, is going to have more smooth muscle. So they're going to be a lot better when we're looking at vasoconstriction and vasodilation. And don't worry about those membranes because they're mainly found in elastic. So the muscle arteries, the tunica media, contains more smooth muscle. And a lot of these are actually close to the surface where they can be a pressure point or a pulse point. So because they're closer, you can palpate, you can feel that pulse that came. Remember, the elastic arteries shoot it through all the pipes and you can palpate it. A pressure point is when you have a large artery near the surface. So if there is any kind of hemorrhage, you could put a tourniquet or you could tie off that vessel at the pressure point to prevent excessive blood loss. So that's not commonly recommended, right? But if you're in danger of bleeding to death, then you could apply the pressure at the pressure point. Now, the arteries are going to feed blood into smaller vessels called arterioles. They just know they have a small lumen. You don't have to memorize the diameter here. So they're smaller and they're more numerous. And so the blood flows into these from arteries. They have a thick tunica media and a lot of smooth muscle. So these are our main vasoconstrictor and vasodilator vessels. So vasoconstrict is when the diameter decreases, and vasodilate is when it increases. And this is critical in controlling blood flow. So these vessels have what's called vasomotor tone. You already learned about vagal tone for the heart. Well, vasomotor tone is due to norepinephrine. So norepinephrine is released, and in smooth muscle, it binds to what's called an alpha-1 receptor. And when norepinephrine binds to an alpha-1 receptor, it actually is going to open calcium channels, which will make that muscle contract. So norepinephrine causes vasoconstriction. And all of these arterioles are always getting some norepinephrine release, so they're always partially constricted. This will be important later when we talk about blood pressure. Now, the capillaries are the most numerous of all the vessels. They have very, very thin walls. In fact, they only have the tunica intima, or you could call it the endothelium. It's the only layer, one layer of cells. So they're perfect for exchange. They'll be really good for filtration and diffusion. And the blood here is the slowest, which makes sense because if you're trying to exchange with your tissue cells, you want the blood to go through pretty slowly. Once the blood flows through the capillary and it exchanges with all the cells, it's picked up by venules. So you can see arteries are the big ones. They're going to branch into arterioles, which branch into capillaries, capillary beds. The capillary bed is drained by the venules, which are small veins, and then they will ultimately drain that blood back into the veins. Now, the veins are bringing the blood back to the heart. The two largest veins in the human body are the superior and inferior vena cava. So you can see the inferior vena cava here, and remember the superior is above the heart. Now remember that the largest artery will be the aorta. When we look at veins, they can be medium or large size veins, but veins have a few characteristics. One thing, they're called reservoirs or capacitance vessels. They can actually stretch a little bit. So we would say they're distensible, meaning they can stretch and they can hold blood in them. So a lot of time at any given moment, most of your blood is actually inside your veins. They have the same 3 layers as arteries, but their tunica media is going to be thinner. So veins actually have a much larger lumen than arteries, but they have thinner walls. And the reason they have thinner walls is because they're under considerably less pressure, so they don't need the thick wall. Now, with these veins being such, so low in pressure, remember that the blood is trying to get back up to the heart. And if we're looking at our lower extremity, it's moving against gravity. So veins are going to have some structures to help move the blood and prevent the blood from pooling or traveling backwards. And when I say that, you should be thinking of valves. Remember that the heart had valves to prevent the backflow of blood? Well, so do veins. And they're just like the semilunar valves of the heart. They're just little flaps here of endothelium. And what happens is when like a muscle contracts and the blood moves up, once the blood moves up, as it starts to flow down, it closes the valve. So it kind of helps keep the blood moving back up to the heart. So the valves are there to prevent the backflow of blood. Now, these are obviously very important in our lower extremities, but they can also be found in our upper extremities. We have some other factors that help the venous return. Remember, the venous return is literally the blood trying to get back to your heart. Our skeletal muscles contract, and when they contract, they squeeze the vein and they like milk the blood up. So muscle contractions are very important. You never want to stand perfectly straight with your legs locked and not moving. your blood will start to pool. It won't make it back up to your heart. And if it doesn't get up to your heart, remember, if your venous return should drop, if venous return decreases, then so does your EDV and so does your stroke volume. So you might get lightheaded and you might pass out. Another thing that helps venous return is breathing. This is called the respiratory pump. So remember that the diaphragm is the structure between the thoracic and the abdominal pelvic cavity. So in this diagram, you can see the green area is the thoracic cavity, and this kind of like reddish, I don't know what that is, reddish color is the abdominal cavity. And you see the diaphragm here. Now, when we inhale, okay, so for inspiration, the diaphragm contracts. So remember that normally the diaphragm is a dome-shaped muscle. So I'll kind of draw it like this, okay? Now, when it contracts, it's going to flatten out. So I'll try to use a different color here so you can see that. So let's say it drops to here, okay? Notice that when the diaphragm contracts, notice what happens to the volume of your thoracic cavity. Do you see how it got bigger? Well, we know there's a relationship between volume and pressure. It's called Boyle's law. If the volume of an area goes up, then the pressure in that area goes down. And if the volume of the area decreases, the pressure goes up. So what's going to happen is, remember that blood follows pressure gradients. So when the diaphragm contracts and flattens out, the volume in the thoracic cavity goes up, and the volume in your abdominal cavity goes down. So what that does is that changes the pressure. The area where the volume decreased makes the pressure increase, and the area where the volume went up makes the pressure go down. And so the blood will follow the pressure gradient, and it will move up the inferior vena cava into the thoracic cavity. So now we need to get it in the heart. So that's the expiration. When you exhale, now the diaphragm returns back to its size. Well, notice now what's going to happen with the volume of your thoracic cavity. Remember, we'll do a dotted line. It was about that big. So now the volume went down. Well, sorry, I had a moment. I was trying to get my marker and it turned off my recording. So when we look at the volume, when the diaphragm relaxes, notice again that we have the diaphragm relax. It goes back to its dome shaped. I'll try to make it flat when it was contracted. So now what happens is the volume in that area dropped. Well, if the volume goes down, then the pressure goes up. So now the pressure goes up in your thorax, and that's going to push the blood into the right atrium. Now, remember when that happens, try to get another color here. So remember we relaxed, right? So we went here from here. So now notice what happens here to the volume. See how the volume in your abdominal cavity is going to go up? So then that allows the pressure to fall, and now the blood moves from your legs up. So the very act of breathing causes the change. The diaphragm changes, which changes the volume of the cavities, and the change of volume in cavities changes the pressure, and that's what allows blood to move back to your heart. Now, varicose veins, you've probably seen them before. These are leaky valves. So they tend to be genetic, and if you stand a lot, because if you stand a lot, you're always dealing with gravity. And so what happens is those valves don't work, so blood pools, and they get very large and bulging and a little unsightly. So usually what they do is they can just get rid of them. So they can inject something in it. They can do laser surgery. They basically get rid of the vein. They remove the vein or strip the vein, and it's okay because other veins take over, but that will help with those. And then a hemorrhoid is basically a varicose vein in the anus or in the rectum. They're usually due to increased pressure. So maybe if you're constipated and you strain a lot to have a bowel movement, or if you have a patient who has had a child, all the straining and pushing for labor and delivery. And so it's usually trapped blood vessels. So we're going to wrap this up with a quick comparison of arteries and veins. So you have a picture down here showing you an artery and a vein, and the artery is actually this one and the vein is this one. So if we look at arteries and veins, we know that they differ in the direction they transport blood. So we know that arteries transport blood. Let me try that one. I was just seeing if you were paying attention. So we know that arteries carry blood away from the heart, and we know that veins carry blood back to the heart. We know that the walls are different. Arteries are going to have very thick walls, and they will have a smaller lumen when we compare them to veins, whereas veins have thin walls and large lumens. So if you look at this picture, you can see the artery wall is really thick, right? The vein is thinner, and the lumen of the artery is here, but this is the whole lumen of the vein. It's just flattened out, so they usually have a larger lumen. Now, the reason, again, is because veins have very low pressure. In fact, the lowest pressure of any blood vessel is a vein. Pressure decreases as it flows away from the heart. So the very lowest blood pressure is in your superior and inferior vena cava. Whereas the arteries are going to have the highest pressure, right? The aorta is right off of the heart. We know that the arteries are going to be better for recoil, for that elasticity to set up the pulse wave, whereas the veins are going to be stretchy to store blood. We know that arteries have the fastest flowing blood. Veins is slower. Now, it's not the slowest. Do you remember what I told you the slowest was? Capillaries. Remember, capillaries have the very slowest because they're the exchange. Valves, they're found in veins. They are not found in arteries. O2 content in the pulmonary circuit. Remember, the pulmonary artery is going to carry O2 poor blood, and the pulmonary vein is carrying O2 rich blood. Those models are colored red and blue depending on the blood inside. When you see red, it's telling you it's an O2 rich blood. So when we look at systemic, that's when our arteries are going to be red with all that O2 rich blood, and our veins are going to carry O2 poor blood. So this wraps up our lecture on blood vessels.